Welcome to this In-Manor introductory webinar. Our aims today are to introduce a new concept in accessible cosmetic dentistry. But this is a kind of cosmetic dentistry that many more patients will actually have. We're going to cover the basic principles of in-manor treatment. We're going to look at some case examples and applications. We're going to talk about how to get started with the education, forum and all-important mentoring. And you're going to see how this ethical and profitable treatment can benefit your practice and, most importantly, your patients. So, what's the significance of the in-manor liner? Well, look at this patient, someone who had already had referrals, understood what all the other options were, but had refused them. It was only when the in-manor liner came along she decided to actually go ahead and have the treatment because she knew it was going to take 9 weeks and not 9 months. This patient was going to have veneers. Again, she had refused fixed orthodontics. She didn't want anything stuck onto her teeth, and the removable options that were presented to her were too slow. So she went ahead and had an in-manor liner, and in 10 weeks she was in this situation, with one appliance on 18 hours a day. This patient again was considering having veneers. The two central incisors would have been heavily prepared. In only 6 weeks we achieved this position. It raises the question as why anyone would want tooth preparation when in such a short period of time we can actually move the teeth. Sometimes, of course, veneers are still necessary, but this should be at the end of the pathway of treatment. So firstly, we straighten the teeth, we re-evaluate, we will try some mock-up bonding on this patient. If the patient isn't happy, doesn't like what they see and wants to go ahead and place veneers, well, at least now the teeth are straight, we can go ahead and place veneers and the patient will be satisfied. All done in the most minimally invasive way. So the key features of the in-manor liner are that it is fast and it will move teeth typically between 6 to 16 weeks. It only needs to be worn for 16 to 20 hours a day. It uses gentle, consistent and steady forces. It's just one simple appliance through the whole treatment. Sometimes we finish with a single clear aligner, but the in-manor liner will do by far the majority of all the treatment. This makes it highly cost effective and also much faster than other systems in similar situations. Why do patients like it? Patients like it primarily because it's fast. It's also relatively cheap. Importantly, with its removability, it fits into an active lifestyle. Being able to remove the appliance for up to 8 hours a day means that a patient can still go out, have dinner, and just live a normal life. And this removes the barriers to treatment and means that a lot more patients will actually go ahead and have it done. Importantly, patients can also find you easily. So what about the in-manor liner itself? Well, there's two main moving components. We have a retracting labial bow and an advancing lingual bow. Each in-manor liner is made on a digitally corrected model. This means that when it's placed in an uncorrected mouth, the forces are already there, pushing in a gentle and consistent fashion. This means that little adjustment is ever really actually required on the aligner itself. So it makes it easy to use. What kind of cases can we treat? Well, we can treat standalone cases, we can treat align bleach bond cases, and we can also pre-align before using further ceramics when actually justified. Let's look at some cases now. This patient presented wanting clear aligner therapy, but when she discovered the time and the cost involved, was quite put off. The in-manor liner was offered as an alternative, and in only 4 weeks, this patient was thrilled with the end result. Not only was it significantly faster, but it was also significantly cheaper. Here's the same patient at 5 years. This case is a little bit more complex, but once you've done the training, you'll understand that through careful progressive IPR, done in a sequential and strategic manner, a case like this can actually still treat out in only 6 weeks. More complex cases can also be handled. Again, through education, you will understand that sequential anchor placement, progressive IPR, and also something called PPR, predictive proximal reduction, can be used to actually treat cases like this, again in under 16 weeks. The inman aligner is great for mild class 2 div 2s. This patient wanted veneers, but actually was made to understand that the two laterals would receive an aggressive amount of tooth preparation. So she decided to have an in-man liner and retract the teeth. And amazingly, at this position, decided she didn't want to go any further. No veneers needed. This is what we call progressive smile design, where we always start with alignment first, allow the patient to review their smile, and then decide where to go next, be it bleaching, bonding, or then perhaps veneers. It's a similar story with this patient, someone again who was considering veneers. After straightening her teeth with an inman aligner and combined expander, which took only 9 weeks, she was happy with the end result. No further treatment was needed. Here's the same patient from the occlusal view. The inman aligner with combined expander is a really neat tool that doesn't affect the occlusion, but it does allow the teeth to pass each other more quickly for faster, more effective results. This is something that we teach you on the course. Retractions will also work nicely, again if the occlusion allows. We could show you how to retract teeth and also retain them. This case treated out in only 11 weeks of treatment. And you can also combine in-man aligner treatment with crowns. This patient had his lower teeth aligned, and that allowed him to change or have his upper crowns changed for EMAX ceramics to achieve a nicer result.
The inman aligner has also been responsible for the concept of progressive smile design. Take this patient for example. She could have easily have ended up with 8 to 10 ceramic veneers. This would have been conveyed to her through wax-ups and imaging, and the patient never would have really seen her teeth straighten and whiten. Because the inman aligner is so fast, and because the teeth can be whitened at the same time, the patients can actually view their teeth in a completely different way and make a completely different outcome. This patient actually ended up with an inman aligner bleaching and bonding done in only 9 weeks. And actually she looks like she's had veneers, but there's absolutely no preparation done whatsoever. So ultimately she gets the most minimally invasive outcome possible. And here's her teeth close up. The two centrals would have received a lot of aggressive preparation. Instead, they are just retracted, the laterals are advanced out, the teeth are slightly roughened for edge bonding, and then with nanohybrids, the teeth are actually built up in a very simple manner. Here's another patient who could easily have had a dramatic smile makeover done with ceramic veneers, which of course in this case would have been irreversible. Instead, through alignment, bleaching and bonding, the patient actually ends up with a beautiful natural smile with virtually no tooth preparation done whatsoever. Here is a side view of the same case. So the upper left lateral was in crossbite, the inman aligner pushed it forward, derotated the other lateral, we bleached at the same time in the last 2 or 3 weeks of alignment, and then simple edge bonding was used to improve the outline. No veneers whatsoever. And here's a very close view of the same patient. The inman aligner had a bite raising appliance fitted to it. Minimal IPR was carried out, and the case treated out beautifully in a very short period of time. So the nice thing is that the concept of progressive smile design and alignment bleach bonding really gives any dentist the power to do something very dramatic. Again, this patient could easily have had ceramic units, but the truth is there's only really very few people that can afford and want to do that sort of treatment, and there aren't actually that many dentists who can carry that sort of treatment out effectively. However, the concept or process of alignment, bleaching and bonding is very simple. It's very low risk. So we can actually achieve these sorts of results in only 12 weeks, and this is extremely dramatic and gives every dentist a lot of potential power. And finally, if we look at this case, again, a patient who could easily have had a radical solution, possibly even considered an extraction on the upper right lateral. Instead, the patient ended up with simple alignment, bleaching, bonding, and also the replacement of one crown. All things that really any general dentist can do. And as a result, achieve this result in only 18 weeks. If this case had been carried out with 10 ceramic veneers or bridge work and multiple ceramic units, there wouldn't be many patients out there that could actually have this sort of treatment done. And again, there probably wouldn't be many dentists out there who'd be confident to carry it out. Alignment, bleaching and bonding allows any dentist to carry this sort of treatment out, and it widens the net for many patients as well. So is it safe? Well, of course, the Inman aligner has been around for 11 years now. There have been many thousand cases used now, and in the United States, some of the beta testers are still using the system who are well known and respected orthodontists. The Inman aligner itself is safe simply because of the science, and the science suggests that removing orthodontic appliances for 4 hours a day minimizes risks. It also uses very light progressive forces. So this is a very suitable treatment for any general dentist. So how do you learn more? Well, of course, training is involved. The Inman aligner itself is a clever device, but actually the way you are trained to use it really unlocks the potential of how the system works. We teach you how to make the cases run fast. We've been very lucky to have many dentists from all over the world come and take our course and give us some great feedback, and all the way along we're constantly looking and striving to improve the course and improve the quality of our presentation and the way that we lay everything out to make it as simple as possible. And many dentists, of course, have been using the Inman aligner for a while, and many of them have done multiple cases, and it actually has changed the way their practices operate. And this for us is a very nice thing to see, because it makes running these courses very much worthwhile. So our hands-on or online courses enable you to implement the Inman aligner into your practice the very next day. But that's not all. What you also get is free support, and that support is done through a forum which will give you comprehensive case mentoring. This is completely free to anyone who's certified with the Inman aligner. You'll also get plenty of marketing material, including free brochures and free videos. And we can also provide you plenty of web content. The support service is there so that for your first cases, in fact for any cases, you can post them up, we can say yes or no, we can treatment plan them for you, we can look at your cases through the treatments as well. Remember, this is completely free. Once you've taken the training, it doesn't cost you anything to do this with the standard support service. The hands-on course is divided into a morning lecture and afternoon hands-on session. Everything that we cover in theory in the morning is repeated in hands-on in the afternoon, with plenty of discussion, hands-on models, IPR stripping, composite anchor placement, everything you need to do to understand how the aligner works. In the morning we cover patient selection in detail. We go over everything you need to look at through the consultation. We make sure you understand the concept of arch evaluation, the effects of occlusion, how to get great compliance, what you need to do with mid proximal reduction, expansion, composite anchors, and then finishing and retention. There's also free training for the team given by Mari Coxon from Philips. This is designed for staff to be able to put the Inman aligner into practice the very next day. So the SpaceWise software gives you arch evaluation right on the spot in front of your patients, and then also provides a great prescription for your technician. He knows where the teeth need to go to. We'll also cover how 3D arch analysis can help with more complex diagnostics, and also how 3D printing has moved accuracy and inman aligner predictability along in leaps and bounds. We'll cover everything you need to fill out your lab dockets and what to expect when you get the work back from the lab. We're going to cover in detail interproximal reduction, how to use strips exactly, how to use discs and potentially IPR handpieces. You'll understand how much to do and where, but most importantly you'll understand why you're doing this IPR and what the implications of it are. You'll be given IPR guides from the lab. The lab will explain how much IPR you need to be carrying out on day one. We're also going to cover the ingenious device that is the inman aligner with combined expander. We're going to cover the advantages, the indications and also the instructions. These devices are ingenious because they actually knock weeks off the treatment time. How long would this case take with clear aligner therapy? Probably at least 6 to 9 months. Well, this case treated out in 9 weeks with an inman aligner and combined expander, less than an hour and a quarter of chair time. We're also going to cover composite anchor placement. Getting these anchors placed sequentially and in the right position can make the difference between a case taking 6 weeks and 6 months. This case is an example. With correct sequencing and correct placement, this case treats out in literally only 9 weeks. And of course, with your inman aligner guide, you'll also be told where your anchors need to go. They'll be marked on your models, and also you'll understand the sequence that they need to go on. In the course, we're also going to cover how to adjust the aligner. Not something you're going to need to do up front or through the treatment, but maybe towards the end just to help finish a case. And of course, we'll cover finishing with clear aligners. You'll understand the indications of them, how to adjust teeth to make sure that there's a pathway for movement. And of course, we'll talk about Essex retainers, how and when to retain and what sort of instructions to give your patients as well. And of course, we have our bonded retainer. And we have a great system, very ingenious system, lab made, which means that really all you need to do is take an impression. 2 weeks later, you book a 5-minute bond up, and we're going to show you how these work, how they click on, how you bond them. It's a real low hassle system. And we'll give you some good tips so that patients have nice, smooth retainers in their mouths that don't feel irritable or annoy them. And you'll find that after 2 or 3 days, the patients will actually not even know they're there. So of course, we're also going to talk about profitability. The inman aligner is being used as a treatment instead of perhaps doing veneers on some patients. And of course, you can make a lot more money with veneers. But the fact is, in many cases, the inman aligner or treatments as such are the right thing to do. So we'll give you some ideas on what to charge, just suggestions. And you'll see how the average treatment time with inman aligner being only 2.5 hours and with such a low lab bill can mean that you really can get great profitability. There's no reason why anyone who trains in the system can't carry out up to 10 cases per month on your own patients. There are that many patients in your practice who would have this done. You'll be surprised. Of course, there's many labs all the way around the world. Wherever we go and run a course, one of our labs will come and support. And these labs are labs that we work with, that we've trained to use the system and understand how the dentists use the system as well. There's also an inman aligner online course. I would always say the hands-on course is better, but the online course is there for people who can't book onto the hands-on course and want to take the course immediately. And it does give you instant access to the support forum as well. So limitations of the system mean that case selection and patient expectations are imperative. The inman aligner, as we've already said, isn't for every case type at all. It's not for patients with large posterior issues. or who require class setup. Space requirements are very important, and arch evaluation is also very important. We need to ensure that these cases are suitable, and where's the space actually going to come from. And of course, for cases that are not suitable, we always recommend referring to specialist orthodontists or use alternatives if you are skilled with them. The benefits of the Indiranagar are that it really does create high patient acceptance. You will see a new market of patients who just wouldn't have had anything else. The treatment is highly profitable and low risk for GDPs. There really isn't much that can go wrong, especially if you follow our protocols and you carry out progressive, anatomically respectful IPR. You'll have the ability to do simultaneous bleaching for better patient motivation and better profitability. You'll have the ability to de-radicalize or perhaps do no preps at all. This concept of alignment, bleaching, bonding and progressive smile design is very powerful, and it really can be a practice changer for many people. And if you've done this sort of treatment before, really it can be far less stressful, and it's great fun to see how patients actually respond to it. So really, if I can sum up the Indiranagar, it's all about simplicity, it's about ethics, it's about doing the right thing, but it's also about getting amazing results that really can change a patient's life. Hope to see you on a course one day. Thank you.